It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everybody. Welcome to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz. Give us a call, please. Give us a call, 1-800-848-WABC. It's 1-800-848-9222. Good morning. Good morning, Philippa. How are you?
Very well, thank you. What is in your coffee this morning?
You haven't had coffee.
Not yet. You can tell, can't you?
No. Well, no. You look well. You're on Fox this morning, right?
I was talking.
In a nice white dress there.
Absolutely.
Yeah.
I don't normally do my makeup for coming into the radio studio at such an early hour on a Sunday morning.
You should. You look very nice. What were you talking about this morning on Fox?
We were talking about patients who are very involved with their care actually cost more when they're in hospital. And this actually was a study that came out of Chicago. They looked at 22,000 patients, and this was internal medicine patients, and those that were more involved with their care and were talking to their doctors much more. The cost of healthcare was actually more in those patients, and we were discussing that, but we used that to springboard onto talking about what questions patients should ask their doctors, and what are sensible questions to ask if you want to be involved in your care, and what questions are not sensible. There was a list that came out, the top 10 list of questions that you should ask your doctor. Some were pretty sensible and others were silly.
What was the top one?
Well, what the top one was, do I really need this test?
Not are you board certified? Or
No. But
are you a board certified doctor?
No, but the one that did make me laugh.
When was your last lawsuit?
No, the one that did make the top two sensible ones were, what questions should I ask my doctor? Yeah. And also, how many surgeries have you performed? Very sensible questions. But one of the questions I thought was...
Yeah, but if you're in the hospital, I mean, I assume that you've already... Maybe you came in emergently. You may not have a choice, with doctors.
Sure. I mean, this was just a general
right.
discussion. I mean, the study actually focused on internal medicine patients, but the top 10 list was separate. But what was interesting was that one of the questions that was recommended that you should ask your doctor, which I thought was silly, was what year did you graduate from medical school? And it was implying that if you'd graduated...
Not where you graduated medical school.
No, what
or
year.
Did you graduate
So this list was implying that if you ask your doctor this question, you should pick a doctor who's more recently graduated rather than somebody who's old in the tooth. And I thought that was a silly question.
Old in the tooth? No, well, I don't...
That's a British expression. Have you not heard that before?
No, it's not a common one here, no.
So, I mean, it's silly, isn't it? Because I know plenty of older doctors who are very well read and very well up to date. Also, there are those that are not.
And are experienced in the operating room.
Absolutely. And then there are those younger doctors who... they may be very well up to date, but experience counts for a lot as well. So,
also,
there's good and bad.
I think younger doctors, too, are looking to operate probably more. I mean, I've been in the field now for about 25 years, and I probably send away more than I actually operate on and say, look, you don't really need this right now.
That's because you send it to me.
But you too. I mean, you've been out for a while, and you gain the experience, and not only should you operate or when to operate, but is it really needed at all?
That's right. I mean, I think that we have to remember to be the patient's advocate and to not offer procedures unless it's medically needed or it's something that the patient feels that is in their best interest as well.
Well, on the heels of that discussion about asking your doctor, you'll have plenty of time all day on June 15th to ask us and many other doctors that'll be at the Men's Health Seminar, right, Philippa? We want to remind everyone that you do need to sign up. There's 2 weeks left. We do have a lot of people that have registered. Actually, we were talking before the show that many more have signed up already this year than last year. And many wonderful vendors will be there, so you can learn and meet and greet not only other people and men that are, have the same condition that you do, but also companies that have state-of-the-art medications. Nutraceuticals will be there, nutraceutical companies, vitamin companies, and so forth. So it's menshealthseminar.com. That's menshealthseminar.com. Also, there's a phone number if you don't want to go onto the internet. And what is that, Philippa?
That's right. Joe, who's been helping us organise the last few years of our seminar, is very good at helping people register. If you're not on the internet and you want help, then you can call Joe on 609-947-5090. That's Joanne on 609-947-5090. And Joe can take you through the registration process if you're not on the internet. And she's been fantastic support. And every Sunday, she tells me immediately after the show, she gets lots of calls. So take down that number. And, of course, you can register online at menshealthseminar.com. In fact, I looked down the list of people that have registered, and there's many familiar faces from previous years. I see a number of people have registered, as well as new people. And, in fact, last weekend, I went home and collected my own father from the UK. So he's now on New York soil, all ready for the seminar himself. So...
And the other thing that we have going on in Garden City is we've started a prostate cancer support group. And this has been a wonderful way for men to come together and talk intimately about what's going on with a doctor. Sometimes we have a speaker. And we have an excellent speaker coming up, Brett Mellinger. We've talked about him a lot on the show. He's actually been a guest here. He's an expert in sexual healing, sexual reproduction, and techniques used to help men to get back into the bedroom, if you will, not only beyond a Viagra. He's a wonderful guy, but you do need to sign up for that as well if you're interested in coming to the support group. And Philip, you have that information.
Yes, that's the prostate cancer support at winthrop.org. Bit of a long email address there, but prostate cancer support at winthrop.org. And that's on June 12th, as you said. That's a Wednesday in the evening, 6:30 to 7:30. Telephone number for that is 516-663-9615. That's 516-663-9615. And in fact, both you and I have spoken at that support group before, and it's a great opportunity for men to share their stories. And,
it is. It's also,
it's
partly run as well by Joel Nowak, and he comes out. He's a prostate cancer survivor. He talks about his experiences, and also just another venue for men to come together that are going through similar things. Some men have not been yet diagnosed with prostate cancer. Some have, and then some have been diagnosed with advanced prostate cancer. So you can really get a sense of what's going on in an intimate setting, and it really is wonderful. So we encourage you all to sign up for that.
You know, they were asking me at Fox this morning about what people call in about on the show, and I said the commonest questions that we get are about PSA and prostate cancer issues, treatment options, and also testosterone issues. So if you're listening to the show and you want to put Dr. Katz and I on the spot and tell us your story and you want some advice, we're in the studio alone today, so we definitely have time to take your call. So give us a call on 1-800-848-9222. Pick up the phone. We're right here live in the studio waiting for your call on 1-800-848-9222.
Very good. And, with the warmer weather, Philippa, and boy, it really changed quickly, didn't it? I mean, it went from, I think, like a light spring to deep summer this past week, and the last few days have been very warm. And with the warmer weather, most urologists realize that this is stone season now. People don't drink enough water. They go out, whether they're playing tennis or even golf. You're just outside, doing your normal activities, let's say, but you do get dehydrated. And when you get dehydrated, it can make the urine very concentrated and much more likely to develop stones. And I know you've been seeing a lot more patients this week, Philippa, with patients coming in with the typical feelings of having a kidney stone. So tell us a little bit about that. What are patients describing to you this past week?
Well, as you know, it's been an interesting week of patients. In fact, as you know, one patient had a catheter that had been chopped up at home, which was quite an interesting case to sort out on a Friday afternoon, but we got there in the end. But yeah, this week in particular, I've seen a number of patients, men and women, with kidney stones, and people who've not had a kidney stone often think that kidney stones affects older people, but we know that it actually affects younger people as well as older people. So all ages are at risk of kidney stones, and they typically say that men are more prone than women to stones because women have the estrogen is protective against stones to a degree. However, we are seeing more and more women with kidney stones. That's probably related to worsening diet, actually. But we know that in the hot weather, you're more likely to get kidney stones. And essentially, kidney stones form because the salts in the urine crystallize out. And so if your urine is if your urine is concentrated, you're more likely for those salts in the urine to crystallize and form a stone. So do remember, particularly in the hot weather, the more you're sweating and the more dehydrated you are, the more likely you are to get a stone, and those crystals will form a stone. And if you're exercising, then there's a double risk. So for guys, the best way to decide whether you're drinking enough water is to look at the colour of your urine. And the urine should look almost colourless. And
pale, very pale, very
pale.
light.
That's right. And if your urine is concentrated, anything more than a Chardonnay is too much. So drink more and the more you keep your urine dilute, the less likely you are. We also know that oxalate-rich foods increase your risk of...
and what are those? Tea? I know tea. Chocolate can do it.
Well, it's often the things that we consider as healthy. So oxalate-rich foods, things like raspberries, strawberries, spinach, nuts. A lot of people eat a lot of peanuts and cashew nuts, and they're rich in oxalate. So if you're not sure, if you go onto the internet and Google oxalate-rich foods, there's a huge list. And so we know that that's an increased risk. Some people think that dairy can increase your risk. Actually, that's not true. It's the oxalate that's the problem, not the calcium. So you can eat as much cheese, milk, dairy products, and that's not going to increase your risk. But if you don't change your diet at all and do nothing else, drink more. And I tell all my patients to get a large jug of water and keep it in the fridge and chop up several lemons into a jug of water, and the citric acid in lemon juice actually protects against stone formation because citric acid is a stone preventer. So that's a good thing to do.
Excellent recommendation. I've seen a few patients this week that have come in with the classic symptoms. And, if you have a stone in the kidney and it's not moving down the tube, the ureter, it may not cause a lot of pain. But when these small little stones, Philip, like 1-2 millimeters, they usually will pass on their own, but it can be extremely painful when they're going down that tube, the ureter, causing inflammation, some pain, edema in the kidney. And it's an easy way to make a diagnosis. I mean, you may have a little microscopic blood in the urine. We can send you for a urine test. But we also do in the office ultrasounds, which is a nice way, a quick way, without radiation. And an ultrasound today is pretty much the gold standard of just taking a look at the kidney and the ureter and seeing if there's any swelling. And sometimes we can identify the stone. And then, as Philippa said, if you drink more water and use these techniques, sometimes you can pass them. Sometimes you can't, and you have to have a stent in the kidney. But that's rare, but it can happen.
That's right. And if you've had a stone, you remember that pain very clearly, particularly when it's recently passed. But we know that people who have kidney stones are definitely at increased risk of forming another stone. And if you've had a stone, that risk can be up as high as 50 to 100%, certainly within 5 to 10 years. So once a stone former, potentially always a stone former, unless you change your dietary risk factors. So stone prevention advice is very important. And it brings us back to the fact that many of the things that increase your risk of stone formation, red meat, we know, increases your risk. And again, we see that with increased risk of prostate cancer and other cancers. So again, we're seeing diet, lifestyle, very relevant to urological conditions. So if you've had a stone and you want to come and discuss stone prevention advice with us, it's very much on topic at the moment with the hot weather. Keep drinking plenty of water. Yeah.
And we can do a standard analysis of your urine to check for the electrolytes in your urine, as well as in the blood. As Philippa just said, red meats. Well, you think about uric acid and gout, and uric acid stones can also form in this type of a weather, and can be also very painful if you have an underlying gout condition or you're eating more of those kind of rich foods like shellfish. We tend to eat, maybe in the summertime, people are eating more shellfish, more red meats. and those can precipitate uric acid stones.
And if you've had a stone and you've recently passed it, who knows what other stones may be up in the kidney waiting to come out on their journey. A patient said to me earlier this week, well, why is it that the big ones tend to cause less pain and it's the little ones that cause all the trouble? And that tube, the ureter that goes from the kidney to the bladder, is made of muscle. And if the stone's little, the kidney tube will take it on and try and expel it. And it's that muscular wave of contractions that gives you that what we call renal colic. It's very typical,
and it's very painful. I mean, it's some people describe it, even women describe it as painful as it was going through pregnancy. It's extremely painful, and if it gets lodged and if it gets stuck, well, then you need to go to an emergency room and have some high dose narcotics. But
touch wood, I've never had a stone. Have you?
Hopefully, I have never had a stone. No.
Although I do know a number of urologists that have, and in fact,
yeah, sure.
A urologist that we both know, whose name we won't mention on air, actually pulled out his own ureteric stent because he couldn't cope with the stent irritation, and that was quite an interesting story.
Well, we'll go to the phone lines now at 1-800-848-9222. Good morning, everyone. It's 7:18 in the morning. And again, we want to remind you, menshealthseminar.com. You do need to sign up and register. There are just 2 weeks left before the seminar. We hope to see you all there. Good morning, Mike. You're on the line from Connecticut. What can we do for you?
I had the green light laser treatment for my prostate March 26th of this year. Bleeding lasted about 7 weeks. My question is, my flow is much better, but I have now a great deal of urgency to go, and if it comes on very quickly. And
yeah, well, the one thing about the green light, which is a procedure that we do quite a bit, it's an outpatient procedure, and that green light will open up the passageway in the prostatic urethra, so it'll really improve your flow. But it may not take care of an overactive bladder condition, Mike. And if your bladder is still irritated, you may need a little medication if it's still bothering you to calm your bladder down, let's say. Or you could have a new onset of a urinary tract infection that you may have developed from the procedure, which is causing you to have this irritability.
I had it checked. The reason I had the green light, I was forming bladder stones, and the immediate follow-up visit was, the bladder was completely empty, and as I said, the urge to go comes on very quickly. But I could stay a great deal of the night without having to get up, as long as I don't drink too much beforehand. And my urologist told me, your bladder has to be retrained to, now that it's getting more flow.
Yeah, I mean, that's true. There is a dynamic, between and a balance between what's going on in the prostate and the bladder. So there is a healing point. But you're telling us you're about three months out now, right? Or almost 3 months out. And
it should be cleared by now?
Yeah, I would think you probably should be. Philippa, what would you recommend if he saw you tomorrow?
Well, first of all, I've got two questions for Mike. First is, did they get rid of the bladder stones as well, or are they still there? And secondly, did you have a lot of irritation before the procedure, or are these irritation symptoms, have they come on since the green light?
They've come on since the green light, and I haven't gone for a cysto yet to see. I'm going the 24th of June for a flow study to see.
Well, your flow is fine. I don't know if you don't need a flow study.
Did they take the stones away?
All the stones were gone.
Okay. Well, it's interesting. I mean, the green light laser certainly can cause some irritation. The energy from the laser can irritate the urethra, and in fact, I had 2 patients last month who were recommended green light elsewhere, and I advised them not to have that, and I actually did a plasma button on both of them because they had quite marked irritation symptoms before the procedure, and I thought that they would certainly have increased symptoms afterwards. I mean, one thing that may be worth doing, it might be useful in this gentleman to consider doing the urodynamics.
Yeah.
The urodynamics, Mike, that's what we call the EKG of the bladder. It's where we can look at the filling and emptying and see whether your symptoms are related to prostate tissue that's still there, or whether it's related to the bladder muscle being overactive, and that can certainly guide treatment with medication. I would recommend that.
I think it's reasonable, although I think, Philippa, Yeah, I think that's a reasonable way to go, and this way you can get your diagnosis of really what's going on. The other thing would be to maybe just try for a week one of the what we call anticholinergic medications, if you want. The newer one that we've been using, I don't know if you started using this one, Philip. It's called Mirabetriq, and typically has no side effects. You can get a little bit of dry mouth, but I think Philip's point about getting this EKG of the bladder, the urodynamics test done in the office can come up with a proper diagnosis for you, Mike.
Thank you. Could I make one comment?
No. Yes.
As a faithful listener to your program,
go ahead.
I think it's made me alert that there are specialists and specialists. When I hear, a urologist who does a million different procedures, and and go to the hospital for certain tests, like you said, your pathologist at Winthrop is someone who just looks at urological tissues, and
yes.
I think people have to look more, and I am going to do that more if something needs to be done, to go to real specialists who are, whose field is much more narrow than a general urologist.
Sure thing, Mike. I think that's a very good point. And I think that's one of the nice things about going to academic, centers like ours, where you do have people that, look, I'll be honest, I don't take care of kidney stones. I don't take care of urinary incontinence. I just deal with the prostate issues. If someone comes in and they're having, a woman comes in, I'm not going to see them. I'm going to send them to Philippa. If someone comes in with an erection problem, I'm going to send them to Dr. Mellinger. We have infertility specialists, and I think you make a good point, Mike, and I appreciate you calling, and I appreciate you listening.
Just a comment on that, Aaron. I mean, I totally agree with what Mike's saying, and also with selecting specialists who focus on a particular area. I also do think that the converse of that is that sometimes specialists can be too specialised, and that's why it's great when we're in an academic centre. I'm thinking about the meetings that we have at Winthrop, where we're talking about journal club, and we're having grand rounds and these academic meetings, because even if you are a specialist, if you're in an academic centre where you're being educated, then you're still keeping up to date about areas that you may not be using in your practice, because at the end of the day, we have to remember that we're dealing with patients and not just with an individual stone or an individual prostate. And but thank you very much for your comments, Mike.
Okay, let's go back to the phones. We have a few more moments, and we have Ralph who's calling about a possible stone.
Good morning. Thank you for taking my call. 2 months ago, almost to the day, I had a kidney stone. 7 days later, I was luckily I passed it. But what would have been the procedures if I didn't pass it? What are the two ways of, I understand there's a couple of ways of extracting the...
Well, there are. And, I'll turn it over to Philippa. But, and when I was training, which I don't think as much has really changed in terms of the management of stone disease, if something hasn't passed, it's either going to be to blast it, which is called extracorporeal shockwave lithotripsy, where you sit on a table and there are beams that are electrical beams that are shock the kidney and pulverize the stone.
Now let me just say this. I had gone to a urologist before I passed the stone, exactly 2 days before I passed the stone, and he said that he wouldn't be able to do that procedure because it was too close to the pelvic area.
It's possible. It depends upon the anatomy. That's exactly right. It depends not only upon the stone size, but where the stone is sitting, especially
3 millimeters.
Well, 3 millimeters is going to pass. Typically, if it's less than 10 millimeters, most of them will pass. Most, not all. Depends upon not only the size, but also how the stone is formed. Is it very round or is it sharp edged? Because if it's sliding down a tube.
Well, I was able to retrieve it out of the bowl that morning, and it was sort of rounded, not too jagged, and it was, like I said, 3 millimeters.
Okay. And the other way to get out the stone would be to go up through the ureter with a scope, under anesthesia, of course, and extract it, and either extract it and put it in a stone basket, or to trap it in a stone basket and to laser it. Let me turn it over to Philippa. Philippa, what do you think?
Yes, well,
what are the options
first
here?
of all, before I forget, Ralph, if you manage to catch your stone, hang on to it and take it to your urologist, because we can send that stone to the pathology department, and we can do a stone analysis on that and find out what the stone is actually made of. And that can be very, very useful at advising you on all the diet and lifestyle issues to prevent further stone formation. It probably is made of calcium oxalate, but if you've got the stone, hang on to it and we'll analyse it. As Dr. Katz has already said, what we do about stones depends on how big it is, where it is, and how much obstruction it's causing to the kidney. The lithotripsy, the shockwave lithotripsy, is excellent at fragmenting stones, but again, it depends on the position. If that stone is in the lower part of the kidney, unless you stand on your head for most of the day, the fragments probably won't come out. So great for upper and mid-pole stones. Thankfully, the days have gone where we have to actually open the kidney and do open surgery to take stones out. We don't do that anymore. Very, very occasionally we can put a tube directly into the kidney through the back, but most stones we can deal with.
And that's really for the bigger stones.
For the bigger stones, yeah, that's called a PARC. But shockwave lithotripsy is great for stones in the kidney, particularly if they're in the upper stone. But the best thing, above and beyond everything else, of course, prevention is better than cure.
Absolutely, yeah. So, and you want to just go through those tips again, because I liked hearing those tips that you gave. Not only the dietary, which would be staying away from, obviously, the red meats to prevent uric acid stone, the oxalates, and go on to the internet, because there is, as Philip has said, an entire list of foods that are oxalate rich, and if you have a propensity to develop stones. But then there was some other dietary things.
That's right. So if you're a nut eater, just remember nuts are very high in oxalate. See a lot of guys who are eating nuts. Cut down on the nuts, drink plenty of fluids, particularly when you're exercising. We'd normally recommend drinking 3 litres a day in the summer. That would give you a urine output of about 2 litres a day. It sounds a lot. It is a lot. You have to be very committed.
3 litres a day.
3 litres of water. It's hard to do, but it's important that you keep the urine dilute.
Wow.
And if you've had a stone, you'll be very committed to trying to prevent another one.
Yeah.
The citric acid, the lemon juice is key. So if you're out in the Hamptons, you can get organic lemonade, but the cheap way to do it is jug of water, get some fresh lemons, squeeze the lemon juice in there.
How about a little lime and vodka? Will that help?
Absolutely.
Right.
Always.
Great show. We want to remind everyone in the last 30 seconds to come to our seminar, which is on June 15th at menshealthseminar.com. And the phone number?
The phone number is 609-947-5090. And actually the program is on the internet. So go to menshealthseminar.com and you can see the program.
Tune in every week. This is Dr. Aaron Katz.